Hi, everyone. I want to thank you for coming to our little presentation about anxiety. So most importantly, I just want to, as we go through this, kind of let you all know, because I believe the majority of the individuals that are going to be watching this are college students, that you're not alone in your day-to-day struggles with anxiety. I think as you kind of see the statistics of anxiety and how prevalent it is among college students, that you're not alone in your daily struggles and that many people are also experiencing the same thing that you are. So kind of just to start out, what exactly is anxiety? Anxiety in general is a normal part of life. We may experience stressful things day to day that may cause us to worry about what might happen in this moment or may make us worry about what the future might even hold. Anxiety can become a concern when an individual feels like an intense feeling of excessive or persistent worrying and fear about everyday situations. So, general anxiety is normal day to day, but when it becomes like prolonged over like months to years, that's when it can be concerning. So different signs and symptoms. It's common, like different common ones, like people feeling like they cannot get enough sleep. They might experience a different level of insomnia and like might even find difficulty concentrating in class. If you're looking at a screen and you just can't comprehend what's going on, that's when we might be concerned about anxiety disorder or just like generalized anxiety. Those individuals who find themselves having anxiety might experience an involuntary increase in their heart rate, meaning they don't mean to increase it by like exercise or something. You're just sitting there and your heart rate starts to increase. They might hyperventilate, so kind of like, freaking out. So your breathing would increase. And they might experience anxious thoughts, kind of like, oh my goodness, what's going on? I'm not good enough, things like that. Some more typical signs and symptoms of those anxious thoughts, increase in heart rate, and it might also begin to sweat because, again, involuntary increase in heart rate, your body kind of thinks it's exercise, you're doing something along those lines, so everything else would kind of follow along with that. Along with these symptoms, the individual might become lethargic and may become weak. But characteristically, these individuals will experience like feeling like they may be in danger, even though there's nothing around them that would, kind of cause that. They may also panic during a situation or may dread a certain experience. So through this word bubble, you can kind of take a look there about what some of the different signs and symptoms might be. So just kind of take a look at that very quickly, and then we'll move on to like different statistics. So how prevalent is anxiety among either college students or just the general population? According to the Centers for Disease Control and Prevention, it was noted that adults who were over the age of 18 were 9.5% experienced only mild symptoms, 3.4% experienced only moderate anxiety, and 2.7% of the United States population experienced severe symptoms, so like life-changing symptoms. So from these statistics that were just updated in 2019, it can be noted that over 15% of adults, which again, over the age of 18, found themselves experiencing anxiety symptoms. But while those statistics might seem alarming, it's more alarming to know that these are only the documented cases. So there might be other individuals who experience anxiety, but just kind of haven't expressed their concern to their physician or haven't been diagnosed with an anxiety disorder, which we'll discuss later. But it's important because I believe most of us that are watching this are college students. So how prevalent is anxiety among college students? From the statistic on the slide here, you can see that 63.6% of the college population experiences anxiety. That's over half of us. So the Journal of Adolescent Health, they conducted several surveys where they found this statistic. Again, that's over half of us. So how concerning is that over half of us are experiencing anxiety on a day-to-day basis? Now, it's important to note that of these students, the level of anxiety, it may be different for each individual. It may be just be anxiety about a test or a presentation like we're doing here, or whatever it may be. But for others, this level of anxiety may be chronic, so it might prolong over months to even years. For example, like chronic anxiety, if you feel pressure throughout your entire college experience from like your parents or from yourself, because I know many of us put pressure on ourselves to get great grades, it may cause us to actually become chronically anxious. Whatever the reason may be, though, we're going to evaluate later on different ways to prevent and ways to cope with it because that are easy. And I know college students are busy, so kind of ways that we can incorporate that into our busy schedules. But, it's really important also to note that you're not alone. From this, you can see that over half of us experience anxiety on a day-to-day basis. So right now, we're going to just watch a little bit of a video. It does discuss depression as well, because I believe anxiety and depression is prevalent. So through the the authors of this video, they kind of went into going over that. So from that video, you can see how prevalent anxiety really is among college students. So in the video, just some facts that I think are really important is that it is completely normal to feel a level of anxiety on a on a day-to-day basis about different things like tests, presentations, whatever it might be. Like I said, it's completely normal to have an increase of heart rate or breathing pattern. We're experiencing something stressful or that is high pressure, such as like taking a test, a job interview. That is completely normal. While these feelings might make us feel horrible or might make us feel physically ill to the point where we may actually throw up, the feeling may actually give us a sense of motivation. So in the video, Dr. Holland, he says that a certain level of anxiety can actually motivate us to be better. So our bodies know what they're doing. So a certain level of anxiety may actually benefit us. So the most important aspect of this occasional feeling of nervousness is that it does not affect our everyday lives. So if we can go throughout our day-to-day routines without it being affected, that's the most important part. Like many aspects of healthcare, we may consider the differences that a disorder may have among men and women. Just going over quickly, women are twice as likely to actually experience anxiety than men. And the Journal of Psychiatric Research noted that women overall may be diagnosed more often than men with certain types of anxiety disorders. And as we know, men might not be as willing to go and talk about their problems. Things to avoid when feeling anxious. I know a lot of, three of us on here are nursing students. Coffee, we're sponsored by Dunkin' here. So coffee may actually be to avoid when you're feeling anxious, as well as drugs and alcohol. And you don't really want to put too much pressure on focusing towards like what the end result might be. So while it might feel awful to be anxious in the moment, this generalized feeling is now considered to be a medical diagnosis of an anxiety disorder, which Jacqueline will go to discuss further on. But the comparison between anxiety versus anxiety disorder is important to note, and like I said, will be evaluated further. But the most important aspect to carry with you through this presentation is that an anxiety disorder does not go away, but it follows you around day to day. And also important to note that you're not alone in this the journey. So Jacqueline, if you want to go on and discuss anxiety versus anxiety disorder.
Okay, so anxiety versus anxiety disorder. So when you think about everyday anxiety, it may occur due to a certain type of event or an issue. So maybe you have a fear of flying. So you know that when you go to you go to the airport and you're gonna fly, then that would trigger your anxiety. That's an event or an issue. So you may have a fear of flying. It may last as long as the event or issue at hand then will subside afterwards. So maybe you're anxious when you're getting on your flight and during your flight, but then when you get off, the anxiety subsides and has a particular reason as to why the anxiety may occurring. So like I said, as you have a fear of flying. So that could be an example for that. And then for an anxiety disorder, this is how it differs. So they may have anxiety without a certain type of event or issue. The anxiety experience may be more extreme in an anxiety disorder, may occur due to unrealistic ideas or events. So you may know in your head that it's unrealistic why your anxiety is occurring, but you're still feeling anxious. You may feel out of control, as if you can't keep the anxiety under control. It just happens no matter what you do, and it may last longer than expected. And individuals may avoid certain events or issues in hopes that the anxiety can be avoided. And there's different types of anxiety disorders. So I have 5 of them listed here. There's generalized anxiety disorder, obsessive compulsive disorder, also known as OCD, panic disorder, post-traumatic stress disorder, which also known as PTSD, and then social phobia or social anxiety disorder. So what causes anxiety? Different things can cause anxiety, such as trauma, stress due to an illness, stress buildup. Certain personalities may be more prone. So some people just may be more prone to anxiety than others. Some people are more relaxed. Other people just are naturally more anxious. Other mental health disorders, such as depression, being related to individuals who have an anxiety disorder. So anxiety can run in families. So it is common to see it in more than one family member. And also drugs or alcohol. So misuse of drugs or alcohol or anything like that can really exacerbate anxiety. And how can anxiety be diagnosed? So a diagnosis may be made by first seeing your healthcare provider. So if your anxiety is really severe, they may refer you to a mental health specialist. But if it's not as severe and you're trying to figure out what's going on, you'll just see your healthcare provider, and he'll assist with diagnosing the anxiety by evaluating you psychologically and also comparing your current symptoms to the DSM-5. So the DSM-5, also known as the Diagnostic and Statistical Manual of Mental Disorders, is commonly used by providers to diagnose an individual with an anxiety disorder.
Okay, so as it pertains to us as college students at Penn State, since that's the population we're focusing on for this presentation, I wanted to just discuss some student resources that we as Penn State students at Altoona have if we're dealing with anxiety issues. So the Sheets Health and Wellness Center, you can make an appointment there to see providers, receive counseling or different therapies to, try and resolve your anxiety issues. There's various activities on campus throughout the semesters. An example would be Hugs for Hounds. Picture in the top left corner there are my dogs from home. I know that when I take them on campus, a lot of students will say, oh my gosh, like my day feels so much better, or, oh, I'm so stressed, but this helps. So things like that the campus offers, really students should try and take advantage of. Adler Sports Complex. So exercising can lessen the overall feeling of anxiety. So you have access to the gym, basketball courts, club sports. There's so much to do there. And then Port Sky was actually done in a statistical study that eating healthy can actually help reduce anxiety.
Self-treatment. Medication and deep breathing exercises are really important. Things like taking a couple 2 minutes breaks just to deep breathe and relax. This was going to help with any type of anxiety or stress, as well as having a regulated sleep schedule and a healthy diet, partaking in activities to give yourself a mental health day, such as painting class or something that you'd really enjoy. Talk to someone you can confide in and support, a family member, a friend, somebody that, you can trust. Pharmacological treatment, antidepressants, which are generalized anxiety disorder, Lexapro, Cymbalta, Exferin, and Paxil and Pexiva. Hope I'm saying these right. These are all medications that are for treating anxiety and hopefully those who experience a lot of stress. How can my friends and family support me? Well, friends and family can be supported by listening, just taking the time out of their day to just listen to what you have to say and not be judgmental, and take your feelings into consideration. Validate what you're going through. Understanding how anxiety manifests. Everybody, certain things trigger certain things and emotions in everybody. So it can manifest in multiple forms. As well as, and staying positive and being reassuring is really important when you're going through these emotions. Encourage professional help. Seek student resources. Talk to a counselor, somebody who could help you experience and process through all these feelings. Encourage self-help methods such as reading a book or something to learn about ways to de-stress and get rid of anxiety by reducing and finding ways to just go about that. Daily changes. What do I need to change in my life routine to decrease my anxiety levels? Don't use your phone first thing in the morning. Appreciate the silence and start your day fresh. Sometimes just looking at the news or looking at all the things you have to do in one day can really just make you not want to do it. It can automatically start stress and just not promote a healthy day. So just give yourself time to breathe before you jump into things. Try to incorporate a couple of minutes of meditation or personal time to yourself to decompress and process the day, and create a workout routine to reduce stress. Sometimes taking a 5-minute walk with your dog, or just just hanging out the mall, taking a couple laps, that could work too.
So coloring is one way that students can reduce stress. Going to go to the next slide, Talon. Just some benefits to coloring. It's relaxing, so it can shift an individual's attention away from challenging situations that are making them more anxious. Their concentration is more focused on completing the picture in front of them and allows them to outlet their current emotions, which helps them feel better. It's a self-help tool, so depression and anxiety symptoms can be decreased since those two things kind of go hand in hand. Daily coloring can be an outlet for individuals that is inexpensive. So it's also an alternative to yoga and meditation. So if traditional strategies like yoga and meditation aren't really something you're interested in, coloring can be a great alternative. And it's actually been proven that 5 minutes of coloring has the same relaxation effect compared to a whole hour of meditating. And then I wanted to touch on a misconception of coloring. A lot of people think that it's only for children, and it's not. I actually use adult coloring books sometimes if I'm free time. But you can see that these pictures of color aren't really something that a little kid would do. Next slide. Crayola offers free printable coloring pages on their website. I actually printed this one off myself the other day. Next slide.
I was muted, I'm sorry. So after this presentation, we kind of wanted to give you this little QR code that actually can test your level of anxiety. So we could just take a few minutes to look at this, but while you're scanning it with your phone, I kind of just wanted to thank you for tuning into this presentation on anxiety. And kind of just let you know that you're not alone. I think all four of us at one point in our college career or another, whether it's like right now during this presentation or at any point, have experienced a level of anxiety. And we just want you to know that you're not alone. There are several different resources on campus to help you, kind of cope. And I hope that through this presentation, you kind of learned, well, maybe I do have anxiety, or maybe I do need to go seek help. So again, we just want to kind of thank you for tuning in. And we hope that, the rest of your college, undergraduate, graduate, whatever your experience right now is pleasant, and that this different presentation can just help you kind of cope with different things that you're experiencing. Thank you so much.